Platelet-rich plasma therapy, or PRP therapy, is a form of therapy that attempts to enhance the body's natural healing process. So in looking at which system is best to use in your practice, it is first important to understand the role platelets play in the body's natural healing process. So inside your blood vessels, the endothelial cells, under normal circumstances, prevent platelets from sticking together. However, when an injury occurs and these endothelial cells are broken, the collagen and van Willebrand's factor underneath the endothelial cells attract the platelets together and they clot. This is the first step in the healing process. The next step is very important when looking at PRP therapy. Inside each platelets are different granules. The alpha granule is a storage unit that stores prepackaged growth factors in the inactive state. These growth factors include platelet-derived growth factors, transforming growth factor, vascular endothelial growth factor, epidermal growth factor, and fibroblast growth factor. After the platelets clot, these growth factors are released, and these growth factors are very important in regenerating tissue and helping the body heal. Now, in addition, bioactive proteins are released from the platelets, which attract macrophages, mesenchymal stem cells, and osteoblasts. All these things together are what regenerate the tissue and help the body heal. Now, in natural blood specimen, 93% of the blood is red blood cells, 6% are platelets, and 1% are white blood cells. So in PRP therapy, we attempt to invert that percentage. So we have 93% platelets, 6% red blood cells, and 1% white blood cells. This obviously, when injected into an injured site, helps as a catalyst and enhance the body's natural healing process by adding a large amount of platelets to the injured area and help improving that healing cascade. Now, when looking at which system is best, there's a couple of very important factors to consider. First, like always, is safety. The Magellan is a completely closed system. When you load the whole blood into the machine then spins the blood down, separating the platelets, and automatically loads into a syringe. So when you take the syringe out of platelets, all you need to do is place a needle on the end and inject it straight into the patient. With other products on the market, you need to draw the platelets out of a syringe into another syringe. Now this causes two problems. First, the sterile field can be broken. As with any medical process, we want to limit the times the sterile field may be broken for safety reasons. Second, you risk activating the platelets. Ideally, we don't want the platelets to activate till they inject it into the injured area. However, when drawing platelets in and out of the syringe multiple times, you risk either damaging or activating prematurely the platelets. Another thing to look at is the reproducibility of the concentration. Now, other products on the market claim to be reproducible for a certain concentration every time. However, it is very limited. For most other products on the market, if you draw 60 cc's of blood, you are limited to automatically getting 10% or 6 cc's of PRP. Now this has a standard concentration for most people. However, with the Magellan, you can customize that concentration to the patient's needs. So you have 60 cc's of blood. If you don't want or don't need 6 cc's of plasma, you can limit that down to 3 cc's of PRP, in which case you have a higher concentration, which is more effective for the patient. Also, you have that customizability available to you. In one kit, you can draw anywhere from 25 cc's of blood to 60 cc's of blood. Now that depends on how much cc's of PRP you need and the concentration you want. For each patient, on a patient-to-patient basis, you have that customizability. With other companies, you need to buy kits specific for the amount of blood you draw. So if you initially intend on drawing 27 cc's of blood, and then you decide maybe I should draw 40 cc's of blood because I need more cc's of PRP, you need to buy a separate kit for that, which, one, could waste money for you, and two, prolong doing the injection. These are two things that make your practice less efficient and therefore less productive for you. So in looking at the different systems on the market, the Magellan system is by far the most advanced and most efficient product on the market, and that's why you should use it. Thank you. I'll speak with you again soon.